Good morning and welcome to the webinar. My name is Jeff Lewis and I am a Director of Employee Benefits here at Cornerstone. Today I'll be joined by representatives from Aetna to review their plans and services, and they've got an exciting new announcement to share with you on a big change in their underwriting process. So that will be good to hear. Okay, what's going on here? Here we go. Sorry, had a little glitch there. So everybody's on listen only mode, but if you have any questions, please put them in the chat box and we'll be sure to address them at the end of the presentation. Here's my information if you want to get in touch with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter, which is chock full of useful information and links to important updates. And be sure that you're on our website and registered to get the content that's available to our brokers clients on our website. If you haven't already, don't forget to register for our cash incentive program, which is back for another year. We'll have 15 winners with a top prize of $7,000 based on both group and individual production through Cornerstone. If you haven't done so already, you should take advantage of EB3, which is an exclusive partnership with Cornerstone that has put together customized benefit booklets and other required items for your clients. It's an automated technology, super easy to use, with great output, low pricing, and very customizable for your clients. So take a look at that. We've got a new landing page on our website that addresses that product, and of course, always contact your Cornerstone rep for more information. And at this point, I'm going to turn it over to Mark from Aetna to begin the presentation.
All right, thank you, Jeff. Mark. Can everyone see my screen?
You're good, Mark.
All righty.
Yeah, I'll go ahead and get it started. Sorry, this is Adam Ruley, and thanks, Jeff, and good morning, everyone, and thanks again, Cornerstone, for giving us the opportunity to meet with your broker partners today. Again, I'm Adam Ruley. I'm the small group market head of sales for what we call Mid-America East, which is made up of Ohio, Kentucky, Michigan, and Indiana. And then joining me today will be Aaron Husline, who covers Dayton, and then also Northwest and Southeast Ohio, and then Marco Quinn, who covers Cincinnati and Kentucky. And Mark, you can go ahead and go to the next slide. And to start, I thought I'd spend some time going over some of our areas of focus for our territory. These definitely aren't the only ones by any means, but definitely some very high priorities for us. Sorry for all the clutter on the screen. I'm not a PowerPoint expert, so my apologies there. There's a lot of verbiage there. But the first one really is that we're trying to structure our benefits so that we can either eliminate or majorly reduce cost as a barrier to routine care and mental health services in particular. Those are essentially two, there's basically two components to affordability when we talk about health insurance. The premium, of course, which we all know is very expensive and continuing to trend upwards. So we're still trying to, find our way there in terms of controlling that escalation. And then there's also the cost share for people who are covered. So talking about things like your deductible, your co-pays, your co-insurance. We found there's a major issue with insured members, not to mention non-insured members, but insured members who are avoiding care due to the cost of their co-pays or their deductible. Obviously, we can't waive cost share for everything because when you do that, you have incredibly high rates. But we've really identified routine care, mental health and substance abuse, and now diabetic care as being areas where we can be highly impactful without negatively impacting premium. So on the screen here under the first bullet point, you'll see a list of services where we have either eliminated the copay or reduced it significantly. The caveat here is that really only applies to non-HSA plans. As we all know, due to regulations, associated with high deductible health plans. We can't have $0 copays for most of these services except for really preventative. But again, so we've, CVS Minute Clinics visits are $0 copays. Teladoc is a $0 copay. New to our portfolio last year, we have $0 copays for outpatient mental health and substance abuse visits. We have very low copays for our generic RX. We have a tier, we call it 1A, that's a $3 copay for a large list of maintenance generic medications. And then a new one that will be coming to our portfolio effective 9/1 is that we'll also have $0 copays for preferred diabetic RX and supplies as well, which we'll touch on that a little bit later on. We literally learned about it yesterday, so you're literally the first brokers in the market hearing about this. There's still some training on it, honestly, that has to happen on our end, so there'll be more to come on that, but that's something that we're really excited to be able to bring out into the market with our next portfolio update that's coming. Another area of focus for us is really becoming easier to do business with. It's something that we've heard, from the broker community and really feedback that we've taken to heart. So in a few minutes, you'll hear from Aaron on some of our updated quote requirements, and Jeff alluded to that as well, which is going to make us much easier to work with in terms of getting quotes. And then on the sold case side, we've recently made changes to our requirements. It's going to increase our efficiency with the sold case process. That's going to allow groups to get to approval and get to installation more quickly and easily. So that's a huge focus with us, for us, is being easier to do business with. And next, we put a lot of focus and energy in becoming a long-term partner for our customers and our brokers. In the early years of AFA, we kind of earned the reputation of being inconsistent with our pricing, writing groups and then giving out high renewals, in the first year, things like that. And over the past 2 years, we've really taken the approach to aggressively renew our groups that are running well, or even moderately well. It doesn't have to be, a great running group for us to give it, a low renewal increase. And really the result has been that we've issued single-digit renewals to 84% of our customers this year. And I should say those aren't just 9.9% increases, just for the sake of saying single digits. We issue a lot in the mid to low single digits. That's not to say we don't issue high renewals sometimes, or sometimes very high renewals. But in those cases, the goal there is to get them priced appropriately so that we can get them into the single digits next year. So again, we've had a lot of success on our renewal side, with issuing low renewals, and then retaining, a large portion of our membership as a result. We know the last thing as brokers you want to do is have to move groups. It's a lot of work for you. It's a lot of potential disruption for your clients, which falls back into your lap when that happens. So that's been a really big priority for us and a big focus. You can go ahead and go to the next slide, Mark. It didn't fit on the prior slide, but really the fourth strategic priority for our market is to allow groups coming from Humana to make a transition to a new carrier as easily as possible. And hopefully that new carrier is us. On the quoting side, we've reduced our individual health statement requirement so that groups with 10 plus enrolled do not need to complete individual apps. And then to add to that, we polled the broker community and we got overwhelming feedback that in general, groups wouldn't want to give up their current renewal date, but would want to find a home early so that there isn't any effective date disruption. They didn't want to make last minute changes. They might want to keep that 1/1 effective date or renewal date that they have now, but they don't want to wait to the last minute or get caught up in that fourth quarter hustle and bustle and have disruption. So with that in mind, we're also offering extended contracts of up to 18 months for groups coming from Humana. So, imagine that you have the group on that 1/1 renewal date with Humana. They like that renewal date. They want to keep it. And again, they don't want to get caught up in the madness, of shopping during our peak season. So you could quote them for a 10/1 effective date on a 15-month contract and allow them to keep that renewal date and a longer contract, keep their rates locked longer. Or you can move them 9/1 with a 16-month contract. Again, you could do it all the way up to 18 months. And if they're a group of 10 or more enrolled, you can do it without having them fill out Form Fire or any other sort of mechanism for individual applications. Again, it takes that group off your list of having to find a new home during the fourth quarter when we're all collectively losing our minds a little bit. And then lastly, because we recognize it's going to take a lot of extra time and work for the broker, we've included a broker bonus program that compensates you for trusting us with these groups. It's extremely easy to qualify, and then it starts with the very first group you sell and pays at $50 per enrolled employee. And then it's basically a graded scale from there where you can earn more by placing more of your Humana business again, or with us, excuse me. So again, our philosophy is to make it easy, allow groups to move early, but keep their renewal date if they choose, and then compensate the broker for the effort that's all going to take. So again, thank you. And with that, I'm going to turn it over to Aaron Husline, who's going to go over some of our recent updates.
Good morning, everyone, and thanks for having us. I guess I'll just jump right into it. Let's see. Mark. Oh, thank you, Mark. All right. As Jeff alluded to at the beginning of the call, Aetna has made some strides, I would say, as far as simplifying our quoting for Aetna AFA. And basically, as it indicates on my slide, for groups that are situs in Ohio and Kentucky, and of course it's 2 to 100 eligibles, because that's how we operate here in small group, IMQs are now only required in the following circumstances. So it's basically just 5 situations that require IMQs. The group is currently covered in an ACA plan, and they have fewer than 24 enrolled. The group is currently covered by a non-ACA plan, and they have 2 to 4 enrolled employees, so under 5 in Ohio. In Kentucky, not required for an IMQ. So if they're in a non-ACA plan in Kentucky, no IMQ is required.
Oh, Aaron, can I jump in to clarify real quick on that? Sorry.
Yes, jump in.
We don't offer AFA in Kentucky for the 2 to 4 life groups, so that's why it's like that. I probably should have corrected that slide before, so my apologies. So in Kentucky, AFA is only available to 5 or more enrolled groups. So that's why it's kind of a little bit different for Kentucky. So sorry about that.
No problem. Perfect. Startup groups, we call them startup groups now. Those are groups with no prior coverage. Regardless of size, we're going to need IMQs for those groups. Groups that are requesting an off-cycle quote, off renewal, we're going to need IMQs for those, regardless of size. And we're also going to need IMQs for COBRA participants. Lots of times the COBRA people get forgotten in the quoting process. So when they do pop up, we are going to need an IMQ for those folks.
Please. Sorry to jump in again, Aaron. So
jump
that's
in.
That's only if the COBRA employees were not included on the original quote. So if you include your COBRA employees up front, no problem. We'll still, census underwrite them. But if it's sort of that, as Aaron mentioned, that we forgot about it, the case sold, and the COBRA person, emerges at sold case time, then we would need an individual medical questionnaire for them, but not for the upfront quoting. As long as they're on the census, we're good to go.
Perfect. And just please note that now we are going to require a current carrier renewal to quote with census only. So in all these situations, we're going to need that carrier renewal to quote whether they fall into any of these 5 categories or not. I did put on the slide our underwriting mailboxes. So you can see there for 2 to 50, there's a 1 mailbox, and for 51 plus, there's a separate mailbox. We did separate our underwriting just for volume and experience and those kinds of things. So make sure that either Mark or myself or Sean, if you work with him, or Dan, when you submit RFPs to these mailboxes, please make sure to copy us in so that way we can help track it through the process.
And actually, with them going through Cornerstone, continue to use your Cornerstone.
Yes.
I'm sure they have their own quoting box, so please.
Right, correct.
To make sure that Cornerstone gets properly connected, make sure that you send it to your Cornerstone mailbox.
Sorry about that. Yes, that is true. Okay. Moving on, as far as reminders are concerned, or for those of you who might be new to the AFA world, we do offer 1094 and 1095 reporting for groups 50 and under. For groups over 50, we'll provide some reports to allow those groups to make handle these requirements for themselves. but we do the reporting for 2 to 50. We can now write non-ERISA and PEO groups, and we have a simplified employer application that was instituted when this change was made. We've been doing this for maybe a year now, a little over. So if you've got non-ERISA cases, you know, schools and churches, municipalities, things along those lines, we can write that on an AFA contract. We updated our participation requirements a year or so ago as well, and those requirements are 30% for groups with 10 plus eligibles, and for groups 2 to 9 eligible, it's 50%. So that does help quite a bit as far as declining for participation. We've made it a lot easier for groups to qualify as a for participation purposes. Okay. Recent news, we now offer 100% surplus return on our AFA cases. Previously it was 50-50, and that is our standard. But if you have a group that's running really well and you feel as though they would be excited about a 100% surplus return, we can do that in exchange for a 4% load to the rates. So I would assume that if they want to do this, the surplus return would far outweigh that 4% load to the rates. As Adam indicated earlier, we are making some updates as far as extended contracts. This is for groups that are not exiting the market or groups that are not Humana groups. All cases are eligible to have a 15-month contract if they would like to do that. Standard contract is 12 months, but for a 1% load to the rates, we can extend that contract by an additional 3 months to 15 months. And finally, very exciting news coming with our updates in September to our portfolio. We are going to add a provision for all of our plans to have a $0 copay for preferred diabetic prescriptions and supplies. So that would be preferred generics and preferred brand name diabetic supplies and insulin on our formulary. So we're very excited about that change. More news to come on that. Okay, now I'm going to get into a couple of the value-added services that are included in all of our AFA contracts. This one is a pilot program right now in Ohio, but come September, when we refresh our portfolio of plans, it will be standard in all of our plans for all states. But right now, this program is only offered to customers that are based in Ohio. And basically what it is OTC, which is over-the-counter health solutions. And it's essentially, it's a $25 per quarter allowance to be spent at CVS, and this is per member. So if there's a family of 4, it's $100 per quarter. But for our purposes right now, we'll just talk about $25 per quarter. In essence, basically what it is it allows members to go to CVS to order online or over the phone products that would support their health. And as you can see in the picture, some of the examples would be Band-Aids, acetaminophen and acid tablets, allergy medicine, eye drops, cold and flu medications that are CVS branded. So in essence, these members can, for a year, can get $100 worth of free health support items from CVS. I'm going to go ahead and let you go to the next slide. Oh, go back. I thought there was one more in there. My fault. Okay. So basically how it works is members go to the stores, they take their Aetna ID card, they pick up their supplies, they go to the counter. They can't use the self-checkout, but they need to go to the counter where there's a cashier to help them, and they provide them with their items, show them their ID card, and the cashier will run the benefit through the system. They will give them their credit of $25, and they are out the door. So it's essentially that easy. Now, right now in Ohio, about 60% of CVS stores, retail locations, are participating in this plan, in this program. And by the middle of the summer, it should be all of the CVS retail locations in Ohio. So right now, we're just trying to, get this pilot program up and running. It's been in effect since February, and we've gotten really good feedback from members who are excited about, getting basically free items just through being a member with Aetna. So essentially, that's how it works. You see on the screen, there is a catalog. You can click on that, or when hopefully Jeff will share this, or we'll share it with Jeff, and Jeff can share it with everyone. And you can click on that just to see what types of items are covered under the program. Okay. Since earlier this year, since January, this particular program has been in all of our plans. For groups that renewed with Aetna, they would receive it on their renewal date. And essentially what it is, it's CVS virtual primary care. CVS has decided to tip its toe in the waters of virtual primary care, basically because of our experiences through the pandemic, where people were reluctant to go to a brick and mortar doctor's office because of the fear of catching COVID, or just maybe people don't have a standard primary care physician, but they feel like they need one and they want one. Well, we can help with that, make it more convenient. People can basically choose a virtual primary care physician, maintain that virtual primary care physician, and have services through that primary care physician from the comfort of their own home. Virtual primary care physician can offer preventive care. They can help with sick visits. They can handle chronic disease management. They're available 24/7. And best of all, there's zero cost share. I have not tried this yet, but I plan to give it a try because I do have a primary care physician that I use sometimes, but I like the idea of the convenience of being able to just basically log on, schedule an appointment, and see my primary care physician virtually. The primary care physician has the ability to order testing, prescribe medication, and basically refer you if you need to see a specialist. They can assist with that. So essentially anything a brick and mortar primary care physician can do, a virtual primary care physician can do as well. It's just a different type of relationship. And again, it's not like one of those services where you call in and you get a different doctor every time. You basically scroll through, select a primary care physician that works for you, meet with that primary care physician, and then basically you can be assigned to that primary care physician for all of your care needs. So we're trying to make it super convenient, and again, a zero cost share to the member. All right, piggybacking on that, we still offer Teladoc to all of our plan participants. Teladoc is more of an on-demand type care service versus a primary care service. Aetna virtual, CVS virtual primary care is basically primary care type, where the PCP will route you through the health system. They'll handle all of your needs, and if they can't, they'll refer you to a specialist. Whereas Teladoc is more of an on-demand type service. I've got pink eye, I've got a rash, I've got a sore throat, and my doctor's office is closed. I cut myself. I don't know if I should, if it's something super serious, or can I just handle it at home? It's those kinds of things that a Teladoc physician can assist with, okay? So essentially, you just log in and be seen virtually. You will need to complete a medical questionnaire that takes a few minutes prior to that, so that way the doctor will know if you're on any kind of medication or what your health history is, so that way they can assist you more directly, more carefully, more correctly. But essentially, it's a super convenient service that you can do from your house. You can do it from your office. You can use your cell phone. You can use your laptop. All of those services, you can do. It's very convenient. And then if you need a prescription, the physician that's helping you can prescribe to the pharmacy of your choice. Basically, the costs are listed on the screen. So a general medical visit's about $49. If you need mental health services, the price list is there as well. And if you need dermatology services, it's $75. If you're receiving mental health services and you're not in an HSA, as Adam alluded to earlier, all telemedicine is covered in full. There's no copay. And that's essentially it. If you're in a standard plan, your general medical visit will be your primary care physician copay. And if you use dermatology, it'll be the specialist copay. Okay. And EAP, again, included in all of our plans. EAP is a wonderful service. We really found out how important it was to people during the pandemic because our EAP line was really, really busy over the past couple of years. And essentially, it's for the member and for the covered members under his or her plan and any member of the household who might not be in the plan. So if there's extended family living in the member's household, they also have access to our EAP services. As you can see on the screen, we can assist with marriage counseling, legal counseling, behavioral mental health counseling, childcare, retirement college planning, tax consultation, debt and budget assistance, adoption, elder care, and veterinarians. Many of these things are referral based. So maybe you just moved to town or you're looking for some assistance to help with your elderly parents. You can call the EAP line and they can refer you to someone that can, to a provider that can assist with those services. I did want to point out that we do offer under the EAP 3 counseling, mental health counseling services are covered under the EAP. So regardless of what type of plan the member is in, even if they're in an HSA, we offer 3 mental health counseling services for free under the EAP program. And that is it. I'm going to pass it off to Mark.
Thank you very much, Erin. Like Adam said, my name is Mark O'Quinn. I cover the Cincinnati and Kentucky markets. I'll go over our our dental portfolio as well as our admin credits and broker bonus program. Main things to remember from this slide is that we're actually combining our dental portfolio. It was pretty convoluted before. Now it's about a 200 portfolio consisting just of PPO plans. The combined portfolio offers a shared list of covered services. Endo and perio and oral surgery are now in the basic category before they were in the major category. So I believe that puts us in line with some of the other medical carriers and their dental plans, as well as Delta Dental and some of the other dental carriers out there. We will allow ortho down to 2 lives, and then we've also relaxed our waiting periods as well, which I'll talk about on the next slide. So waiting periods will only apply to PPO and indemnity plans. They do not apply to our DMO plans. That's like a DHMO, essentially. It eliminates the MEA, member level waiting period administration. They do still apply for starter groups. However, for takeover groups, the waiting period, there is no waiting period based on qualified prior coverage. So this chart kind of breaks it down for you. For starter groups, waiting period applies. For takeover groups, they do not. Any questions there? Are there any questions in the chat that we've missed? It doesn't look like it so far. Okay. Here's a snapshot of our admin credit program. This is important to remember whenever you're doing your spreadsheeting. and you're looking at just the annual cost of our plans, any group that moves to Aetna will receive a $300 admin credit per enrolled employee. If they're in the 51 to 100 space, or if they are level funded and in a surplus position, so for those Humana groups out there, they'll receive an additional $200 admin credit for a total of $500. Our dental and vision works the same way, and I'll talk about that in a second. But that's important to remember whenever you're doing your spreadsheeting. It's pretty much a premium credit. It's a discount without having to ask for it. It's normally averaging out to about 3 to 5%, which is a pretty big chunk when it comes down to your medical premium. We also are doing a guaranteed surplus where if the group renews with Aetna, no matter what their surplus looks like right now, as long as they renew, they'll get back a certain dollar amount depending on how many they enroll. 2 to 4 people enroll $500, or you get back $500, and so on and so forth. So our dental and vision discounts work similar to the admin credits. If you add dental, you'll receive an additional $200 per enrolled employee. If you add vision, or I'm sorry, dental and vision, you receive an additional $225 per enrolled employee. If you are in the 51 to 100 space, I believe it's actually the same thing. It's no longer the 2% off. I think that's a little outdated, but we'll update this slide in a second. So if you are in the 51 to 100 space, it's actually a total of $700 to $725 in admin credits that you could earn if you are in the 51 to 100 space and you add dental and vision. Our dental portfolio has been revamped to offer a lot more robust list of services, like I said earlier, but they're also a lot more competitive than before, whereas the admin credits really offset some of the costs, and we've got a very broad network to help support our members as well. I believe we have over 11 million members nationwide, and coming from a dental company, we actually Aetna would beat out Superior Dental Care and some of the other dental networks out there when doing a netminder report. So it's a lot bigger than you might think. If you have any questions on our dental, feel free to ask us about it. We can always send you more information. Here's a snapshot of our broker bonus program. If you sell 5 cases or 75 subscribers with us, you'll get an additional $75 per medical subscriber, and then it's graded upwards of from there on forward. $100 for 15 cases or $200 subscriber, and then if obviously if you earn this as well as the Humana bonus, they will be added on top of each other. And I believe that's all we got. Were there any questions that we missed, or anything that you guys that are want to know that we didn't cover?
Yeah, we have a question for something Aaron covered regarding the CVS virtual PCP, which is, I think, pretty innovative. I think that's a pretty cool concept. I've never seen anything like that before. The question posed was, does a member have to choose between a virtual PCP and a live PCP? I'm thinking the answer would be no, because they don't really have to choose a PCP, but I'll let Aaron address.
Hi, and yes, that is correct. You can have a brick and mortar PCP and also a virtual PCP. You don't have to, it's not an either or situation. And as you mentioned, we don't require anyone to name a primary care physician. It's just part of the process when you're in the virtual primary care space. If you really like that PCP, you can choose to be assigned to that PCP, but you don't have to choose a PCP, to make them your permanent PCP. You can use it kind of like the teledoc system as well. If you want to call in and use primary care services virtually, you don't have to elect a primary care physician.
Yep.
And Aaron alluded to it. One of the nice things about it is when you do the CVS virtual primary care, you do select PCP from a list. So you'll have options when you enroll, and that PCP will stay with you. So it's not like Teladoc where you're basically taking the first provider available and it's going to be different every single time. With CVS virtual primary care, you do get to select your PCP, and that person stays with you, throughout your, throughout your relationship with them. So it's more of a long-term thing as opposed to like a short-term relationship.
Right. Excellent. All right. Very good. Well, Aetna, great job today. Really appreciate you guys joining us. Good information, really impactful. That's the only question we had. You did such a great job explaining things that everyone got it first time through. We will have this presentation available on our website later today, so you can access it through the Cornerstone website later today. And again, thanks everyone for joining us. We appreciate your attention today, and we will see you next time.
Thanks, everyone. Appreciate it.
Thank you. Have a good rest of your week.